Welcome to the Acupuncture Outsider podcast. My name is Richard Hazel, and in the time it takes for you to commute to or from work, I hope to have shared something of interest about orthopedic acupuncture using motor points, trigger points, myofascial slings, neurofunctional acupuncture, segmental treatments, anything that crosses my mind that seems to be of interest. I hope you'll enjoy it. Hello and welcome to another episode of the Acupuncture Outsider. This is Richard Hazel. Bit jet lagged today. Just got back recently from Sydney, Australia, where Dan Dominguez and I were teaching treatments for lumbopelvic hip complex lower extremity. And when Dan was teaching his day about some strategies for athletes, activating posterior chain, lateral chain, anterior chain, things like that, one of the topics that he covered was using electric stimulation at nerve trunks like the femoral nerve trunk, obturator nerve, something for the superior gluteal nerve, like getting glute medius, TFL, glute min all in one needle, peroneal nerve trunk, some really cool stuff. Most of those things I have done to some degree on patients, but I had never done the peroneal nerve trunk successfully until I watched Dan do it and got a better guidance, by watching for needle placement. And he also did some sural nerve treatment, which is totally sensory. And that one's not, it's not as cool to see on a video. The patient just has to kind of feel it. You're not going to really see muscles firing for that one. But it got me thinking about neuromodulation. That's the McMaster term that I've heard from anybody who's taught or was taught at McMaster. They like to use that word neuromodulation. And so Dan was using that word, and it got me thinking, and it made me think, have I really ever looked at the research on neuromodulation? And that's something I always want to do. If I'm going to use a word, let me make sure I know what I'm talking about. And so I'll go and see if I need to challenge my thinking on what neuromodulation is. So I did that, and I was happy to say that I did understand it, but actually it was a little cooler than I thought. So my concept of neuromodulation was, you could block pain with electric stim, or you can get muscles firing, like inhibited muscles firing stronger with neuromodulation techniques. So let's say like you want to get the quads firing better, you could stimulate the femoral nerve trunk. And I think that's accurate. But so let me just read like a medical dictionary definition. Neuromodulation is the alteration of nerve activity through targeted delivery of a stimulus, such as electrical stimulation or chemical agents, to specific neurological sites in the body. It is carried out to normalize or modulate nervous tissue function. So that's kind of cool. So what we're trying to normalize is perhaps, if it's a pain situation, a hypersensitized sensory nerve by neuromodulation. We know from our own clinical experience that we can stop that pain. This is something I do with sciatica treatments when I'm treating the deep gluteal syndrome, impingement in the hips, and I'm treating L5-S1. I'm also going to treat the biceps femoris and the peroneus longus, because not that they are impinging the sciatic nerve, but because I can do neuromodulation of the sciatica with electric stimulation. So my electric stim in the hip is more about correcting muscular shortening that is actually entrapping the sciatic nerve, but the needles in the leg are doing neuromodulation of the sensory part of the sciatic nerve. So I'm trying to block the pain. And this is, so I was thinking about other things that we do to neuromodulate for people with in pain. And, the most common is for inhibited muscles, where we're getting muscles firing, especially if you treated people post-surgically. They have a lot of muscle inhibition caused by the surgery. If you want to look at research, you want to look for keywords like arthrogenic muscle inhibition, because what can happen is that you have inflammation in a joint, and it can be post-surgically as well, that causes motor nerve inhibition of that muscle. And by using electric stimulation, preferably over 10 hertz, you can get that nerve muscle communication working better. So that's neuromodulation for a motor nerve issue. One that I'm looking forward to using is that peroneal nerve trunk right behind the head of the fibula for a drop foot patient that I have. Looking forward to trying that with her. And I'm also going to use the sural nerve treatment that I saw Dan do, because it follows the pathway of the outer part of her foot where she still has some numbness. I've been doing successful work with the plantar nerve trunk for that outer foot numbness, but I think maybe the sural nerve might get us a little bit farther along, because she's still not 100% there. So I'm looking forward to trying that out. But that would be sensory nerve neuromodulation. And if you're new to things like nerve trunk stimulation, because I think a lot of that we have to give credit to the McMaster program, because I don't know many other people who are doing that technique at the trunk, or like a plexus, like a brachial plexus sort of thing. That, at least that I've seen, I have a feeling that was developed a lot by Alejandro Elorriaga at McMaster, and others probably have, taken that, technique and started to apply it as well. But anyway, so the one of the things that well, let me see if didn't complete a thought about. Oh, so I was going to treat the drop foot patient. I'm definitely going to want to do that for her sensory deficit, as well as try that nerve trunk for the drop foot. I'm looking forward to trying that out. Something else that's neuromodulatory that I'm looking forward to trying would be stimulating S3, S2, 3, and 4 for pelvic floor issues like urinary incontinence. What I didn't know was that in the medical world, they will surgically implant a device to stimulate those sacral areas, the sacral 2, 3, 4, to help people with incontinence. That's like a motor nerve neuromodulation, help good contractions in the pelvic floor for somebody who has urinary incontinence. I think that's pretty cool and definitely worth a try from an acupuncture perspective for somebody who's having those issues. So I'm looking forward to giving that a try. What else? I did see a cool video of a woman who had a deep brain stimulator put in, and that's neuromodulation, but they actually implant something in the brain for spasticity. So they can adjust it, and they get the right frequency, and they're able to basically almost completely eliminated this woman's spasticity on her right arm. She couldn't even hold a cup and drink from the cup because it was so spastic. And once they put the stimulator in and they got it correctly programmed, she was able to very smoothly grasp a cup and bring it to her mouth. And it wasn't perfect, but it was just like enormously improved by that deep brain stimulator. So that's neuromodulation as well. Obviously, we're not doing that, but it's interesting to see what science has discovered about using electric stimulation, because electric stimulation clearly, when it's coming from outside the body, is able to somehow regulate an unregulated nerve. So if the nerve is hypersensitized and having pain, tingling, numbness, being able to regulate that. Oh, and that was the thing I forgot to say. If you're new and you don't do the nerve trunks, just know that you can do neuromodulation with motor points in the muscles. It will still neuromodulate. I had a patient who came in with burning sensation on her forearm, and I think the doctor didn't really know what to tell her, and it was disturbing to her to have this burning sensation. It felt like sunburn on her forearm. And I said, I don't really know either. It does, it seems like it could be some sort of cutaneous nerve irritation. So how about we put some needles in and put some electric stim and see what happens? And sure enough, it stopped the burning pain and it did not come back. So, and actually I had that happen once in my abs. My rectus abdominal area started like just two specific abs, one on each side. So basically, probably followed a dermatome from my back that felt hypersensitized. It, like, just walking the t-shirt would rub against them, and it felt irritated. I would have to, like, basically press the t-shirt against my abdominal area while walking because it was so uncomfortable to just feel that burning sensation. So what I ended up doing was just grabbing a pointer Excel and putting it on motor points of the rectus abdominis at the area that was irritated. And, within 30 seconds, a minute of stimulation, it corrected that burning sensation, which never came back. I don't know how that cutaneous nerve became irritated, but I was glad that I had a way to treat it, because who knows how long that would have stayed irritated. So we can do neuromodulation with electric stim acupuncture using motor points as well. We don't have to know the nerve trunk that should be treated. I saw recently an email from someone else who teaches at McMaster who was doing a shoulder treatment and was talking about neuromodulation of certain areas for that shoulder pain, and he was using segmental treatments, in the cervical and thoracic area. And so then that came to mind as well. And I was thinking, it's a cool idea to think of neuromodulation for getting inhibited muscles firing better and using the nerve trunks, or you could even say, the segmental area of that innervation with that in mind for getting those muscles firing. Because I typically will use the motor point with a high frequency stim to get those muscles firing, but it's kind of a cool idea to think of doing it sort of more segmentally, because you're then getting groups of muscles that are innervated at that segment, and getting them firing there. And I guess you could really do both, but it's kind of cool to think about doing, keep it simple and do it more segmentally and see what your results will be. And the other thought that I had while looking into neuromodulation was perhaps that is a term that we should be using more when we describe what we do to medical professionals, because they clearly know what neuromodulation is. They see the research. They know that people are getting spinal implants. They're getting these sacral implants brain implants for neuromodulation for pain and for motor function. So perhaps we are not taking advantage of the fact that they know that when we're explaining what we are able to do for people who are in pain and having orthopedic issues. And oh, by the way, I came across cool research from 2020, I think 2020 July. I'll put the link in the copy of this episode. Research done using ultrasound guided electric nerve. Neuromodulation of the femoral nerve. So basically, they're doing what we would do with an acupuncture needle. But they're using ultrasound guidance so that they don't puncture the nerve. But experienced acupuncturists are able to do this without ultrasound guidance. But what was cool was that they got like 30 people with anterior knee pain, and they did this neuromodulation at the femoral nerve trunk, and it relieved the pain. And the people felt even better 6 or 7 days after the treatment. So like there was an effect, a good effect from the beginning, which improved over time, over 6 or 7 days, which I think that's kind of cool. And one could argue that it was both sensory and motor, relieving the pain instantly, and then also improving the firing of the quads. And the quads, of course, are the ones that are crossing the knee joint and putting pressure on the patella and causing dysfunctional movement of the knee. So they're kind of doing both with their femoral nerve trunk treatment. So I'll put that research there. I think it's cool that the research is starting to catch up to what we've already known clinically, but having people actually try these methods and test them with real people with pain and validate it in a more scientific way is definitely going to be helpful for us, those of us who are doing orthopedic acupuncture using electric stimulation, because like I say, we can start talking about neuromodulation and really promoting what we can do with orthopedic acupuncture with regards to pain and getting muscles firing better and getting muscles firing or getting regulation of muscles through neuromodulation. I think it's definitely a world that is worth investigating more from an acupuncture perspective, and also something worth promoting in the when we're having conversations with medical doctors. So I guess that's all I want to say today about neuromodulation, but something to put out there. If you're like me and you get kind of nerdy and you like to look at the research, start Googling, neuromodulation for pain, neuromodulation for spasticity, neuromodulation for neuropathy, etc., and see what you see. And like I said, I'll put the link to this cool little study that used femoral nerve trunk stimulation for neuromodulation of knee pain. That's very recent. Let's see what you think. All right, so that's it for this week. Sorry if I was a little bit less focused today. I'm totally jet lagged. I'm like wide awake at midnight, and then in the morning I'm ready to pass out. All right, so everyone have a great week, and I will talk to you soon.